All right, so we're about at that time, so I'll go ahead and kick it off. Welcome again to those of you that are joining. I see there's more signing on right now. We'll get started in just a minute here. Go ahead and feel free to introduce yourselves by selecting everyone. My name is Rebecca Farrow. I'm part of the BHIPP team. I will be introducing our presenter for today and facilitating a Q&A at the end of the session. Following today's presentation, there will be time for questions, so please enter these into the chat. For those of you that are unfamiliar with BHIPP, I would like to provide some information about our program. Maryland Behavioral Health Integration in Pediatric Primary Care, or BHIPP, is a child psychiatry access program that supports the ability of pediatric primary care providers to address and manage mental health concerns. BHIPP is a free statewide program that offers telephone consultation, resource and referral networking, care coordination, and training and educational opportunities. The BHIPP Warm Line is staffed by a team of child mental health specialists and is available Monday through Friday, 9 to 5. Our phone number and website was just entered into the chat for you, so if you have more questions, you can contact us there. And it is my pleasure to introduce today's BHIPP Resilience Break, Supporting Youth Returning to School, the Role of the Primary Care Provider, presented by Dr. Sharon Hoover. Dr. Hoover is a licensed clinical psychologist and professor at the University of Maryland School of Medicine, Division of Child and Adolescent Psychiatry. She's also co-director of the National Center for School Mental Health. She currently leads national efforts to support states, districts, and schools in the adoption of national performance standards of comprehensive school mental health systems. Dr. Hoover has led and collaborated on multiple federal and state grants with a commitment to study the implementation of quality children's mental health services. In 2020, Dr. Hoover was awarded a SAMHSA grant to develop the NCTSN Center for Safe Supportive Schools aimed at integrating trauma-informed policies and practices in school mental health systems with a focus on social justice, supporting students of color, newcomer youth, and other more marginalized students and families. Since the onset of COVID-19, Dr. Hoover has worked with education and mental health leaders across the United States as they support educators, students, and their families with social, emotional, and academic needs amidst the global pandemic. So we are very grateful to have you here today, Dr. Hoover. Thank you for sharing your expertise with us during this session. Go ahead and take it away.
Great, thanks Rebecca, and thanks to the whole BHIPP team for having me here today. I appreciate the invitation from BHIPP and really appreciate all of the work that BHIPP does to support the state. I know I eagerly await my BHIPP newsletter each week to see all of the good work that's happening and the content that you provide, so I appreciate the connection. And we know that schools and primary care are both going to be really integral right now as our young people start schools again. And it's best if we can do this work hand in hand. So again, appreciate the invitation, and we'll spend some time talking today just about how our primary care community can really help support students and families and schools as schools restart. And I know as the parent of 3 teens myself, we are eagerly awaiting school to start on Monday, but also anxiously awaiting school to start. And there's certainly increased anxiety in many ways for young people and families as we enter into this new school year. So we're going to talk about some of that, as well as some of the specific behavioral health needs that you may be encountering in your own practices. We'll also talk about some specific strategies to support student behavioral health as our students restart the school year. It should be 2021-22 academic year. I see it says 21-21. I suppose we're all in a bit of a time warp this year. And then participants will be able to identify at least 3 ways to partner with schools to support student behavioral health. As Rebecca mentioned, I am at the University of Maryland School of Medicine. I'm a professor in our Division of Child and Adolescent Psychiatry, and I have the privilege of co-directing the National Center for School Mental Health. We've been around since 1995, and we're funded out of the U.S. Department of Health and Human Services. And you can find more about what we do at schoolmentalhealth.org, including a whole repository of resources specifically focused on how we can help students and schools in the context of COVID-19. And I know many of us are inundated with resources right now. So we have tried our best to be very selective about what we put up there, and it's all specific to this intersection of mental health and education. I also direct a news center out of the National Child Traumatic Stress Network, so I would encourage you to visit some of our work there at ncs3.org, and that stands for the National Center for Safe, Supportive Schools. And as Rebecca mentioned, that center focuses specifically at the intersection of comprehensive school mental health systems and trauma-informed, healing-centered approaches and culturally responsive, equitable approaches to school mental health. So we have a variety of resources there as well. So let's dive in and consider the context that we're in and why we're talking about school mental health at all. So we know in the context of tremendous loss and community and family burden right now, it is not surprising that we would see an impact on young people's mental health. We know that these impacts cut across all communities and maybe most impacting our communities hit hardest by COVID, including our communities of color and those with inequitable access to healthcare and education. We also know that media headlines, as you can see illustrated here, have been full of speculation and statements about children's mental health worsening. And now we have data evidencing some of that worsening of mental health. But I also want to note that we do want to be mindful and watchful and proactive about the impact of COVID on youth mental health, but we also want to avoid sensationalizing in our language as we talk about the impact, especially when it comes to suicidality, because especially in media formats, we know that that can actually do more harm than good. And the data is yet to be determined on the impact on suicidality right now. So we just want to be careful to look at the data carefully and to understand the impact and a responsible response to it. So we do know and have some data that indicates that mental health challenges are rising. Many of you are working hand in hand or directly in emergency departments and may have witnessed that emergency department visits are up. They are up nationally for children and for adolescents quite profoundly. Also, there have been a number of studies looking at family reports of their own children's mental health, and they are indicating, again, not surprisingly, that for many, they would indicate that their child's mental health or emotional health is worse than before the pandemics. And this is certainly not isolated to children. We also know that families are under tremendous stress. There have been a number of surveys done. This was actually last spring. About 3,000 adults were surveyed, and the findings interestingly indicated that parents or caregivers of children reported significantly higher levels of stress related to COVID than non-parents, with a majority of those parents and caregivers reporting distance learning as a major source of stress. In addition to that, of course, they were also noting things like basic needs, healthcare services, and then just witnessing and experiencing their children and families witnessing major milestones. So what does this look like in an education context? One of the surveys that I found really informative was done by the National Federation of Families. Some of you may have seen this come out in recent months. They interviewed and collected data from families across the nation about the impact of COVID and this experience of schooling on their children's well-being and on their schooling and education experience. About half of the families indicated that it was worse than expected in terms of how they felt school was going for their children. About a quarter said better than expected. So it's been really variable in terms of what we're finding. And then the qualitative data, of course, I found interesting. A mother from West Virginia noting, I'm a working mother, constantly feeling like I'm being asked to choose between my child and my career. There's no choice because without my income, we lose our home. I'm a strong person, but I am begging for help. A number of parents in this survey, as did this parent in New Jersey, indicated that students who were receiving special education are being left behind. Many felt that their special education services were really compromised during this time. And then many also praised the efforts of the school system, as did this parent in Massachusetts. What did caregivers say was the most challenging? Perhaps not surprisingly, many said balancing school and work, or just the time factor, was the highest challenge. Second, meeting special education needs was a real challenge for families. Navigating the platforms of distance learning was tremendously challenging. And then just trying to get the support that they needed from school and from their teachers. Rebecca, I see you popped on. I just want to see, is there something that you need?
I was just going to note, it seems like the screen is obscured a little bit by a few gray boxes, and I'm not sure.
Oh,
I was just hearing from someone attending that we couldn't
okay.
see
Well,
quite
let's go
well.
ahead and see if we can fix that.
Sorry to interrupt.
Not at all. I saw you pop on and wanted to be sure that I was attending to whatever needs to be attended to. So let's just check this out for a minute and see if we can fix it. Huh. I don't appear to be able to share anymore. Is my screen sharing at the moment or no?
I do not see anything.
Okay, so
Heather is here to support us there.
Okay, let's try this again. If nothing else, we have learned new technologies and been patient with new technologies over this year. So let's try again.
There we go. That looks good. Thank you.
You're seeing that?
Yes.
Now I'm going to pull one thing up on my screen, but again, if it appears that something is blocking, let me know. Are you able to see everything with no gray boxes covering it?
It looks like we can see. It looks like we can see the next slide as well, and some.
So you're seeing. I see. Okay.
Yeah.
Got it. Okay. Let's see. Let's see if this works for you. You all set there?
Yes, that's good.
Okay.
Thank you.
Sure. Is it still working for you okay?
Yep, looks good.
All right. We are cooking with gas. Okay, here we go. So we know that this time has been challenging again, unsurprisingly, for young people and for families. And another group that we want to keep in mind as we're thinking about how to support our children and our families as we restart schools are our educators. And in primary care, there are certainly ways that I think the primary care community can support our educators as well. So for many of our educators, certainly across the state of Maryland, this has been their educational experience for much of last year, and some are entering back into this year with virtual learning as well. And it, for many, was a new learning landscape with a lot of complexity and layers of burden that they hadn't had before. This was a statement from a middle school teacher in Washington State that really resonated for many. I spend all day staring at a screen and kind of generating enthusiasm into the void that Zoom is. And I end the day so tired and so done and so frustrated. The moments of joy I used to have are so much more rare. And while we know that the safety measures that were put in place to put distance learning as a necessity, to make distance learning a necessity for many of our children, were critical to their safety, we also know that there was burden associated with it, and that many of our teachers have really struggled in this context. So given this really well-documented impact of COVID on the well-being of our students, our families, our educators, where do we go from here, right? How do we address the issues of anxiety, fear, stress, loss, the inequities, while simultaneously trying to foster hope and resilience in our young people? And for many of you in the primary care community, we know that you are seeing, and we anticipate will see, increases in children's mental health problems right in your office. So let's speak specifically to some of those behavioral health challenges that are impacting schooling during COVID-19. We know that, our partners at the National Center for Safe Supportive Learning Environments have put this into 3 buckets as they talk about the stressors related to COVID. So one being the increased challenges with mental health issues. We have seen increases, and the data follows that we've seen increases in anxiety and depression and post-traumatic stress in our young people. This is not surprising, given the great amount of confusion and uncertainty about what's going to happen next, their own worries and fears for the safety of themselves and others, unknowns about how they're going to operate in this upcoming school year, fears associated with the reopening of schools, COVID transmission, and many of them, we also know from the data, are experiencing unsafe situations at home or in their community, and have been for now a year plus, including things like increased abuse, neglect, and domestic violence, which have also increased in the context of family burden and stress. We also know there's this bucket of loss, right? And for our young people, that may look like extended family support loss, job loss in their family, access to mental health and healthcare loss, loss of family members, community members, teachers, and other students. We also know that our young people have lost these major rituals and transitions and celebrations in their life, things like proms or graduations or end of year celebrations or goodbyes. Many are starting this school year in schools that they were not in before. And so there's an increased anxiety with that. Many had sudden disruptions in normal routines, relationships, structures, predictability. And they also have experienced, for many, food and housing insecurity. And then finally, we know that there's this whole significant layer of inequity, that the disproportionate impacts of COVID-19 in communities of color have really increased risk for these and other stressors. We also know that for many of our young people, they've had disproportionate access to virtual education, whether it's technology access or their learning needs have not been met. And so, you know, in terms of kind of how that falls down to the impact on children's behavioral health, we knew, or we anticipated what was coming in some respects from the data that we had from past pandemics, right? When we look to prior pandemics, so things like influenza of 1918 or the 2009 H1N1 flu, even there's data, and the 2014 Ebola virus, they were all associated with increases in depression, anxiety, stigma, shaming. And we also have data to suggest that there's longitudinal negative impacts of other large-scale community crises like natural disasters. So we have solid data, for example, from Hurricanes Katrina and Rita that indicate that there's a long-term impact on children's behavioral health and academic functioning. So we could certainly anticipate this increase, and we are now seeing it in our schools and in our primary care settings, and certainly at home in our own families. So what are some strategies for supporting children as schools restart? As a National Center for School Mental Health, we've been working in partnership with state education agencies, state behavioral health agencies, and local education and behavioral health supports in Maryland and beyond to develop and implement strategies for supporting children. Our schools have been working for the summer months and prior to coming up with strategic plans. Many of them have been focusing on universal strategies for students, recognizing that it's not just going to be a few students who might need mental health treatment services, but rather many students are coming in with increased anxiety, worry. They need kind of some of that back to normalcy that you would expect after some type of major community disruption. So some of the things we're seeing in schools are a focus on supportive, inclusive, positive school climate, implementation of more culturally responsive policies and practices. We've seen a lot of effort in Maryland around that specifically, and around trauma responsive policies and practices. We've seen more than I've ever seen in my career a focus on staff well-being. And so we have a number of resources focused on teacher well-being, both with the restart of school and then actual practices for educators or for schools to implement to support educators throughout the school year. I'm happy to share any of these resources, of course, and I can do so in the chat box when we get to the Q&A. Social emotional learning is something that many schools are investing in. As you may be aware, the states have received significant funding in the education side through COVID relief dollars, and many are investing in social emotional learning, staff wellness, increasing trauma responsive training, crisis preparedness training, and also mental health literacy for school staff and students. There was a mental health literacy course just released called Classroom Wise. It's a training actually for educators to support their mental health literacy, and it's available freely for all educators across the country now. So many schools are adopting that. But what do we know that kids need? And this is, you know, as you think about the one-on-one meetings you have with families, it sometimes can just come back down to basics. You know, we have families asking us in our clinical practice, what can I do to ensure that my kids are off, you know, start school on the right foot? We know that everything feels up in the air, but there are some things that we know kids need. Age doesn't matter, right? So they need, regardless of COVID, regardless of what's happening in their daily lives, they need to feel loved and protected. They need to understand their world, to know their feelings, and to feel capable of doing the things that they are required to do. So as we meet with families, we want to emphasize these things. They also benefit from having social emotional strategies to deal with these uncertainties and stressors. And in many respects, families have become the de facto educators of mental health supports for their children. Our roles as care providers have often shifted to being coaches and supportive consultants for families. So what are some of the most prominent concerns that you're hearing about from families right now? Think about what are they most challenged by, and feel free to put some of that in the chat box. What are those prominent concerns that you're hearing from families right now with respect to navigating that restart of school? And what social emotional strategies are the easiest to translate to home? So this can include things like helping your children regulate or manage their feelings, helping them identify their feelings in these situations, helping them be flexible in the face of uncertainty. So these will be introduced again, and many schools across Maryland and across the US are actually devoting more time at the beginning of this school year to social emotional strategies than to academic time, but they're certainly spending more than they would have pre-COVID. We talk about the other 3 R's that schools are focusing on right now. So reassurance, routines, and regulation. We encourage schools, for example, and adults, parents, to reassure their children about their safety and the safety of loved ones. Tell them that it's the adult's job to ensure their safety. Second, we can let our adults know, whether it's our teachers or our families, that they should maintain routines to the extent possible and provide children with a sense of safety and predictability. And then third, adults should support children's development of regulation, right? So we know when children are stressed, their bodies respond by activating that stress response system. And to help them manage those reactions, it's really important both to validate their feelings, right? I know this might be scary, this might feel overwhelming, you might be concerned about school restarting, but encourage them to engage in activities that help them self-regulate. Exercise, deep breathing, mindfulness or meditation, regular routines for sleeping. So those 3 R's are really important. It's a simple rubric for talking with families about it as their children return to school. We also know that schools are engaging in daily or weekly check-ins. Some have a pretty informal process of doing that, but we are seeing a huge uptick in the amount of screening or check-ins with respect to emotional well-being that schools are doing. There's one platform that many schools are using. Partly because it's no cost and it's quite user-friendly, but it provides schools a way of doing this daily or weekly check-in where teachers can just get the pulse on how their students are doing when they come into the classroom. And it gives the teacher, and the parents can also get access for their own child. It gives the teacher a dashboard of how are my kids doing in the classroom. They now have an adolescent version, and it also then connects students to someone if they request speaking to somebody in the school building. So these are some of the things that our schools are doing. Of course, they're also continuing to implement crisis models. We were on the phone with some schools some districts in a different state who's already started school in the Southeast yesterday. And they were saying that they're experiencing more crises in their community than they ever had at the first week of school. So I think we can anticipate that there will be more crises. There's much more instability right now in our communities and in our families. So we want to talk with our schools about ensuring that they have crisis preparedness models in place. This one, if you are not familiar with it, psychological first aid. This is different from mental health first aid, which is also quite popular right now as a way of training people in mental health language. But this is psychological first aid, and the school version of this is called Listen, Protect, Connect, Model, and Teach. So if you have teachers in your lives, or if you as a primary care provider are working directly with schools, this is a freely downloadable set of tools that schools can use to be prepared in the aftermath of a crisis. And COVID in our communities is a crisis. I mentioned that many schools are doing check-ins, kind of well-being check-ins. Many are also doing more formal screening. So you may get asked by schools that you partner with, what screening should we be doing? How can we check in if students are, doing okay? These are some of the domains that we are seeing schools screen in. We've seen an increase, not surprisingly, actually a huge number of COVID-specific screeners come out. There are some that are mentioned here. We have a whole table of these on our website if you're interested in providing schools with screeners, or if you're interested in your primary care site. These are the ones that we have on our site are all freely downloadable. Many schools are also looking for ways that they can screen for things beyond just pathology, beyond psychopathology. Things like school connectedness, belonging, thriving, and this is a great example of that, which is a co-vitality. It was developed out of the University of California, Santa Barbara. Again, freely downloadable, something that students can complete, and the schools can get a dashboard of how their kids are doing. So beyond those universal strategies, we also know that many schools are the place that young people get services and continue in services. The majority of young people who get mental health services actually do get them in the school building. Of course, we also have community mental health and other types of mental health services available, but most young people actually get treatment in the schools. We are seeing that increase, and Maryland has put a significant investment into ensuring that school mental health providers are in many, if not most, of our schools at this point. And there's good reason. Again, the data does show that youth are far more likely to not only initiate treatment when it's offered in the school building as compared to other community mental health settings, but they're also more likely to actually complete treatment. The data that you're seeing here was actually a randomized controlled study conducted after Hurricane Katrina, where they randomized students into either receive trauma treatment in community mental health treatment centers. They provided transportation, childcare, and then the others were assigned to school treatment. Both evidence-based treatments. 53 out of 58 completed the school treatment. Only 9 out of 60 finished care in the community mental health settings. And this type of finding has been replicated in other studies where they show that young people, again, are far more likely to start treatment, but also to complete treatment in schools. There are many interventions developed specifically for schools. Many of our schools across Maryland are doing trauma interventions like CBITS, cognitive behavioral intervention for trauma in schools. There's free online training for this for school mental health clinicians. You can go to cbitsprogram.org. There's also one for kindergarten through 5th grade for bouncebackprogram.org. So there's a number of freely accessible trainings to really improve our workforce's readiness to manage some of these stressors. So we are seeing also a number of online interventions that have cropped up. So in the event that you, or perhaps you have behavioral health providers as part of your practice, are seeing your children and adolescents and families virtually, many of the mental health interventions that we formerly delivered or still deliver some in person have now been translated to online. So we have a whole free CBITS online program that was developed really out of the need of COVID. And for many of you, you probably at some point at least had to leverage telehealth technology in the last year to do your work, as did many of our mental health providers, including those working with schools. So let's spend just a few minutes talking through how to partner with schools as a primary care provider or practice to support student behavioral health. So first, we know that it can be really helpful just as a primary care setting that might be trusted in your community, that it can be useful to provide recommendations on policies and procedures to schools that will promote this safe return to school. And many of you likely already do this, whether it's individually with your students and families or to your school partners. AAP, the American Academy of Pediatrics, has a number of considerations that they have put out in terms of a safe return to school. Certainly the CDC has a wealth of information on returning to school. It can be incredibly hard to navigate for families and for schools, and having that trusted primary care provider in their community help them navigate that can be really useful. I already mentioned the impact on teachers in terms of their well-being and mental health. And we know that teachers are one of our most impacted communities right now in terms of burnout and stress. We're seeing greater levels of attrition in their field. So if there is any way in your community to support teachers, that can be really useful with respect to their mental health and well-being. And ultimately, and in fact, there's really interesting and good data looking at the impact of teacher well-being on student mental health, and it's quite profound. So if we take care of our teachers, it will have hopefully a positive impact on our young people. We also know that pediatricians, primary care docs, are a great source of consultation to schools on how they can identify concerns, how they can conduct screenings, and how they can triage students to care. We know with some support at BHIPP and other efforts around the state of Maryland, many primary care folks actually have behavioral health providers right there in their practice. And so there may be a natural connection if schools are able to conduct some screening or triaging, but they don't feel that they can always meet the capacity of the mental health needs of their students. Perhaps they can partner with a primary care office and embedded behavioral health providers, or just link to other community mental health providers if it's not available to provide on site. We've seen a number of primary care folks hosting virtual Ask a Doctor sessions for parents, right? So schools are getting asked lots of questions about health and safety protocols that they don't always feel equipped to answer. And it can be incredibly powerful to have the community primary care pediatric professional come in and just partner with them on an Ask a Doctor session about things like hand washing, wearing masks, social distancing. It feels to many families like and there is reality to this, that the parameters are constantly shifting. And so what is safe, what's not, how do I make the decision, can be really difficult. And so just partnering with schools on that can be quite useful. Providing a list of mental health providers, including child and adolescent psychiatrists in the community, can be really critical as well. Searching for clinicians who specialize in child and adolescent and family therapy, indicating which insurance plans are provided. Again, this can be incredibly hard to navigate for families and for schools. And then creating quick guides. And at this point, you don't even have to create them. There are so many out there at this point, even in the context of COVID, kind of what is anxiety and how to address it in the context of COVID. And I'm going to share a couple of resources with you that you can share, discussing screening options and how to access services. These can be really helpful quick guides for schools that primary care folks can help support. Some questions that you can ask if you're in discussion with local school districts or schools of your patients. What are your school or district plans for this upcoming school year? What are you doing with respect to virtual or hybrid or in-person learning? Last I heard at this week's state school board meeting, I think it was that 22 out of our 24 school districts in Maryland have a newly established or larger distance learning program than pre-COVID. So they've implemented something at this moment in time to support distance learning. Many of them are growing right now, given the current context of COVID. And I know that the couple of districts where they're not yet in place, there's certainly advocacy for them to be put in place. So just asking, what are the plans and how can we best support your students in their environment? What resources and supports will they offer for students' social, emotional, and behavioral well-being? And if they're still navigating that, perhaps providing them some resources. Do you have a social emotional curriculum? Will this continue? Are there mental health providers in the school? Do they have the capacity to work with students? How will students and families access these services? So even just knowing that about the schools in your primary care vicinity can be really helpful when families come to you and say, where do I get mental health services? They often think that they have to go to a specialty mental health clinic when they may be able to get mental health services right in their school. And what are the ways that I, primary care provider, can partner with schools to expand upon existing resources and offer additional supports? Some patient-specific support, as basic as it sounds, getting back to some of those routines is critical. Sleep hygiene, not that it was fabulous to start with in many ways, but really has gone out the window. And there's actually some really interesting data looking at sleep patterns during COVID. So as we restart the school year, supporting families to reestablish routines, including sleep hygiene and some of those basic hygiene routines, can be critical. Providing education to families in your visits with them about distance learning strategies for those that are continuing in a distance learning format or uncertain if that might come. There's some excellent resources that have been put out by the National Association of State Directors of Special Education, or NASD, that you can see here, that really speak with families about what are their rights, what questions can they ask of their school related to special education services through distance learning. Encourage families to connect with school mental health support. Counselors, school psychologists, school social workers, community mental health providers who are based in schools are ready for students to come in with challenges this year. And so having a primary care provider let families know that that's a great place to access services can be critical. Communicate with school personnel about student progress or concerns. We know that You are a busy group of folks as primary care providers, but schools may be reaching out to understand how their young people are doing. And then screening students and families for COVID impact and general well-being, which I'm guessing you're all doing in your practice already. Some of the back to basics that you can keep in mind as you're meeting with families. Families, again, are feeling overwhelmed right now. And so reminding them that one of the most important things that they can do is get their children back to some basic routines, right? That helps reduce stress. It helps people kind of feel that things are predictable. Basic hygiene routines like brushing teeth, changing out of pajamas, brushing their hair, sleep routines. We've already talked about sleep schedules shifting over the summer and over this whole past year. Troubleshooting with families, causes for late bedtimes. We know technology is certainly one of them, and establishing a routine. We often talk about safe, so encouraging families to think of having a safe day with their kids, something social every day, something active, something fun, and something effortful if they're trying to figure out how can they, especially during the distance learning, it felt very amorphous in terms of the time. So this is a rubric that we sometimes used. Reminding parents to ask for help when needed. We spoke about the stress of the distance learning for families, but even as students are restarting school amidst uncertainty, it's important to remind them that they can't do it all. They can ask for help if they're trying to support their child with distance learning and aren't sure how to support their children with that. Reward effort, right? That parents shouldn't gauge their success by the child's outcome of work completion or grades, et cetera, during distance learning or even during this restart of school. They can look to how they interacted with their child. Did they validate their child's feelings? Did they praise positive things their child was doing? So we know that children who are heading back to the classroom this fall are facing unusual challenges, and one of them is anxiety. So when my primary care friends, this is probably the biggest question that they're asking for. How can I talk to my families or my kids about back to school anxiety? For some kids, it'll be separation anxiety, in addition to the anxiety that they may feel about leaving their safe harbor for some from the pandemic. For some, the excitement of going back to school after so many months will outweigh that potential anxiety. But for many kids who already have anxiety, especially, they may be more prone to having anxiety when going back. So parents have, in many respects, a complicated mission when dealing with all the anxiety and uncertainty. They both have to reassure children that it's safe to be away from them, but also encourage them to be careful and prepare them to be flexible in case the situation changes. So it is kind of a very delicate balance. So a few pointers that you can certainly share, and some of these come directly from what I find to be a really helpful resource that you can share with families from the Child Mind Institute. There's a link to it here, and again, I can stick some of these in the chat. One, simply validate feelings. It is certainly worrisome when kids are clingy or fearful about separating, but it's important for parents to stay calm, to stay positive. If your child's telling you that they're worried or having those negative feelings, you want to validate it. Let them have some space to express it, but you also don't want to feed it too much, right? And you want to help them think of something that they can do about it. So we know that sometimes when we overfeed that anxiety, it can actually really reinforce and perpetuate it. You want to encourage parents to set the tone, parents and caregivers. The most important thought about going back to school is that parents lead the charge. If you as a parent lead with your own anxiety, you're going to fuel that anxiety. So you want to say what you know, answer questions, and act calm, sometimes even when you're not. You want to help your children think positively. So another way to help kids focus on positive is to try to get them to talk about the good things at school. What are they looking forward to? What did they enjoy the previous day? Instead of things like, what are you most nervous about in terms of school starting? Practice separating. So for children who are anxious about being apart, practice separating. Start in small ways, building tolerance, maybe extra extended time at grandparents' house, extra time at a friend's house, things like that. Have a routine, make it predictable. That can help calm kids as they lead up to school. You want to emphasize safety measures. We can't promise our kids that we won't get sick, but we can express confidence that the schools have done months of planning to try to minimize risk and to keep everyone safe. Encourage flexibility. So since there's a possibility that children who start school could switch back to remote learning, at least for some periods of time, it is really helpful for your kids to know that and to be prepared for changes that may occur and to not catastrophize that as a parent. And certainly to seek help as needed. So it can be helpful to provide a barometer to families of what does that really look like, right? If my child is just distressed on the first day of school, do they need help or not? Well, kids who have trouble separating often just need time and support from their parents and teachers. But if your child is having severe meltdowns at drop-off, for instance, for more than 2 to 3 weeks, and they're unable to recover or to stay at school for more than 3 or 4 weeks, then seeking help certainly might be warranted and can make a big difference. But many families will ask, is this a normal reaction to COVID or to school restarting after a year, or is it more? And so it's important to equip families with some of the things to really look out for, especially with respect to depression. So things like social withdrawal and isolation, really high emotional reactivity or anger to limits or expectations, if they're losing interest, if they're increasing their tendency to shut down. Certainly if you see an increase in talking about death, interest in death, wanting to be dead, those are huge red flags, and you want to encourage families to get help at school or from primary care or a mental health specialist. We also know waiting lists are long right now, and so that's part of why this safety net of primary care in schools is so critical. There are tools that we can use to encourage our families to ask about mood, and it's things like choosing the right time, not right after an argument with your teen or in the middle of, them playing basketball with their friends, sticking to the facts, telling them specific behaviors you find concerning, validating, right? We know things have been hard lately. Expressing concern, self-disclosing a bit, this is hard for us too, but in a positive, validating way, and being ready for some pushback, especially with adolescents. Some of the things primary care folks can certainly ask in the context of school restarting, since COVID and school disclosures, what's been the most difficult for your family? What positive opportunities, if any, have arisen? Because that's, part of our role right now, I think, is also helping to generate a what some think of as like a post-traumatic growth mindset, but just really that narrative around what has actually been gained over this time, in addition to honoring, validating, acknowledging what's been lost. Have any of your family or community members become ill or died from COVID? Have you had any job loss or financial loss? Have you had any trouble with food or housing? Those are very basic questions that can help assess COVID impact, including impact on school. So how will your child be returning to school? How did distance learning go for your child in the spring or last year? Did you learn anything that could be helpful now? How do you and your child feel about this school year's plan? Do you have any specific concerns, anything you're looking forward to? Again, so we don't want it all to be about the major concerns they have. Are there things they're looking forward to, especially for our anxious kids? Those are really critical questions to ask. You may already have formal screeners that you incorporate in your visits, but certainly these can be a useful tool to see if students are struggling or if your patients are struggling, whether it's the pediatric symptom checklist, the PHQ, the behavioral health checklist, strengths and difficulties questionnaire. These are all being used in primary care practices throughout Maryland. So those are some of the ways that we know our primary care community is going to be essential in partnering with schools as we return or restart school this fall. We know it's uncertain for all of us, our students, our families, but our primary care providers and school professionals, again, are part of this really important safety net right now for our families. So we look forward to partnering with you. We encourage you to reach out to us at the schoolmentalhealth.org site. And I think we have a few minutes for questions. So I'll pass it back to Rebecca.
Thank you so much, Dr. Hoover. That was a wonderful presentation. We really appreciate all of these resources you've shared and this expertise and how we can address the concerns we're seeing together across disciplines here. So we are moving into our question and answer portion. Go ahead and enter those into the chat. We do already have one question that was entered a little while back that I can go ahead and read from Dr. Fulton. And that was, is there a directive or plan from the state level to address post-COVID mental health needs in K-12? So rural and urban, or are we relying on each school district to come up with their own plan or interventions?
It's a great question, and my apologies for not seeing the questions as they came through. I couldn't see the chat box, but it's a great question. We know, as in most of our states, really all, that education is quite locally controlled, and certainly in Maryland, that's no different. The State Department of Education did put out guidance to the local school districts about returning to school, and it had a robust section on social emotional learning supports. But really what's happening in the school districts is quite unique to each school district. Pardon the sirens behind me. I'm across the street from shock trauma, so it gets a little loud here. The good news is that in Maryland, we have a relative to other states, small number of districts. So they work quite well together and communicate quite well. Under the Safe to Learn Act that our governor introduced in 2018, he designated mental health coordinators in every district. And I sit on a call with them every month and listen to how beautifully they are communicating with each other about resources and about how they are supporting the return to school. So while it is locally driven in Maryland, as far as the social emotional supports that are going to be offered, there is a lot of coordination and support and technical assistance from the State Department of Education in Maryland as well. And that being said, I think that it's appropriate in many ways that each district is also navigating some of their individual community needs, because COVID has impacted our districts quite differently in some respects. So they're sharing resources, they're communicating, but what they're doing does vary from district to district. And as I mentioned, the COVID relief dollars that have come down, there's over $190 billion that have come down federally through the 3 buckets of funding through ESSER, which is the funding that's come to schools. 90% of that is going to local school districts, and they have the autonomy to distribute those funds as they wish. And much of that is going towards supporting student and staff well-being. I hope that answers the question.
Thank you for addressing that. And there is a message from Dr. Fulton I'll just read. I don't know if you're able to see it, but she says, many practices have gotten back to their pre-COVID productivity. It would be wonderful if practices could use social media and partner with their local health department to address mental health needs and answer parents' concerns on a wider scale.
That's a great point, Dr. Fulton. And I know that many practices, both on the health side and behavioral health side, really waned in terms of their engagement, their ability to engage young people and families during COVID. I know we have some health department folks on today. They might want to chime in to this point that's being made by Dr. Fulton, but certainly we know that health departments can be instrumental to getting the word out to the community about what practices have openings, how families can access care. And with respect to behavioral health care, we know that psychotropic meds, for example, are largely prescribed in primary care practices. It's part of why BHIPP is such an essential service to the state of Maryland. But a lot of families don't know that they can ask about anxiety and depression and trauma of the primary care provider, right? And they don't know even that if they're seeking medication management or just consultation around these issues, that they can do that in their primary care setting. So to me, health departments could be instrumental in that communication, right? Letting families know, if you have a question, if your child, if you're concerned about your child's anxiety or depression or transition back to school, or if you're seeing these red flags in your child, ask your primary care doc. Now, I know a lot of health departments are communicating those messages, but I agree with Dr. Fulton's point that doing that hand in hand with the practices would be critical and might actually produce an uptick in some of the practices that saw numbers decline. And I'm seeing another comment here. Let's see. Oh, it just disappeared. There's an upcoming event in Howard County featuring Dr. Schulmeyer, who's a champion of this work, coordinator of psychological services, Howard County Public School System. Excellent. Okay, so that's great. So we are seeing our schools in partnership with our health department. I see Dr. Rossman from the health department in Howard County commenting. Howard County has a telehealth program at HCPSS, and we want to grow the program if needed. So having worked with Dr. Rossman and Dr. Schulmeyer and their team for a number of years now, I certainly can attest to the innovation and really excellent work that they've done in terms of the partnership between the health department, primary care, their hospital system, and the school system to support student behavioral health. So if any others are on the call today looking for some guidance about that type of partnership, I think that's a great place to start. And Dr. Fulton saying in the city, the social media is the way to go. So that's great. And that's part of why this individual, district or community tailoring is so critical. How we reach our community may largely depend on the community that we're in. So yeah, I really appreciate these comments.
Wonderful. Thank you for addressing those. We did have a question that was received before the session that I wanted to ask you. When PCPs are referring for mental health services, what resources are typically available at the school, and what resources would need to be referred to outside of the school?
It's a great question. And I will say it depends on the school system and even the individual school within the district. In Maryland, there are many districts and schools that have partnerships with community mental health, and I'll speak to those in just a moment. But first and foremost, every school has some sort of school mental health as part of their school employed professional team. Now, that may not be a robust array of providers depending on the community, right? So you may have one school psychologist that serves 5 to 10 schools in a community. Many of our schools, especially our secondary schools, have school counselors. A lot of their time may be devoted to post-secondary career and college planning. So I would first turn to your school employed professionals. Again, your school psychologists, school social workers, school counselors, even your school nurses. Sometimes schools have occupational therapists who are working in schools. Starting there can be a good place. We have a number of schools in Maryland who also have school-based health centers. If you have the fortune of having a school-based health center in your school, that would be a great place to turn to as a primary care provider. You can turn families there. You can go to the Maryland Assembly on School-Based Health Care to see the full list of schools that have school-based health centers, and I know we have more coming in Maryland. You can also look to the school district, your director of student supports, for example, at the school district level, your local education authority, to see what services are provided in the schools, or simply refer families to their schools to say, here are the professionals you want to ask about. Does your school have a psychologist, social worker, counselor, school nurse? Then many schools have community mental health providers. Baltimore City, for example, I think it's 122 out of their approximately 160 schools has an expanded school mental health provider. So we have 6 mental health providers across 6 mental health provider agencies across Maryland that, across Baltimore City rather, that have mental health providers in the schools that come from the community. And they provide universal services, but they also provide what you might think of as outpatient mental health in the school building. Howard County has an increasingly robust system that looks like that. Many districts on the shore, similarly, they have a school mental health coalition and they have many providers. I know I'm missing out on counties here because I've seen this in many of our counties. Prince George's has a similar program. So you're likely to find mental health services in the school building, and primary care providers can be critical to letting families know to start in their schools. And frankly, there's actually data that shows that students are going to lose less time from school and families less time from work if they can access those services during the school day rather than outside the school building.
Wonderful. Thank you for addressing that. Sometimes it's hard to know where the services are, so that's great that we're learning more about. They really are already out there, so that's good to know. Yeah, I was really interested by that statistic you shared that I believe 6 times more students are receiving services in schools, so that's wonderful. Another question we have, we talked a lot today about routines, and we did also mention that there's going to be some uncertainty, expectations might change, even setting might change, hybrid or not. How do we help children navigate this uncertainty? Could you speak to that a bit more?
Yeah, I mean, I think it goes back to some of what I spoke about with respect to anxiety, right? And we know that, again, some of our young people started with a higher baseline level of anxiety. So they're going to be more at risk of, having great anxiety as we restart the school year. But even for most of us, that's our adults and our young people alike, we are struggling with the uncertainty. Most of us tend to do better when things are predictable and familiar. And so as adults in our young people's lives, we can acknowledge that, right? That it can be hard. Again, that validating of feelings is critical. This can be challenging. This is hard. I understand you're anxious. Helping, especially our younger kids, label their feelings and understand, when their stomach hurts or they don't feel like getting out of bed, that all may be related to their feelings of anxiety or of feeling uncertain. We have to be modeling positive response to this to the extent we can. When we catastrophize things, our children are more likely to catastrophize things as well, and really encouraging flexibility. So letting your children know, if school happens to stop again, close again, we will work together as a family and cope with it. That does not, and I in no way want to minimize what a struggle that type of change can be, right? For when, many families are eagerly awaiting the start of school so that they can get back to work, or that they can go back to search for work at this point. Many families lost jobs in the context of COVID, and some lost work as a result of having to stay home and care for family members. So in no way am I minimizing it. And at the same time, it's important for families, to let their children know that they're going to create a safe and as predictable as possible environment for their children.
Yeah, that's excellent advice and something we could probably all use ourselves sometimes. So thank you again for this presentation today. It's really been very informative. I don't think that we have any more questions at this time, but I did want to just mention a few housekeeping things.
Great. And I want to mention, I'm going to stick a couple of additional resources in the chat box. And thank you again for having me here today to talk with you.
Yeah, thank you for sharing those. And then the recording for today's presentation, the slides, and a list of resources, which will overlap with those resources Dr. Hoover's entering in the chat probably, will be available on the BHIPP website next week. And we will send CME and CEU certificates to participants in 3 business days. Please remember to take the survey as you exit. A new window will automatically pop up when you exit the webinar. And as a note as well, our next BHIPP Resilience Break is in honor of Recovery Month and will be hosted also with Maryland Addiction Consultation Service. This event will take place on September 17th at 12:30, and more details, including registration information, will be sent along with your CE certificate or can be located on our website. But thank you all for coming today, and of course, thank you to our wonderful presenter, Dr. Hoover.